Good evening, everyone.
Good evening,
Welcome,
sir.
Good evening, sir.
welcome,
Good evening,
welcome
sir.
to
Good evening.
ACUTALK.
Good evening, sir.
Good evening, everyone. Welcome to our brand new episode of ACUTALK. We begin 2025 with this beautiful topic on TUINA. Now, our friend Shripatji will help us with the pronunciation also, how you would like to pronounce it. All right. So, we will, listen from you very shortly. But before I hand over the proceedings to Shripatji, I would like to add a very interesting concept here about this uh, field of massage. Okay, and I would request everyone who is present to type in their questions, their views, and what they understand by the various topics so that it will be easy to answer at the end of the session. Now, I was reading a very interesting article that there are, on a functional level, two types of ki or chi. We all know there is the yin chi or the nutritive chi, and then there is the wei chi, which is the protective chi. All right. Now, this wei chi is there on the surface. It is there, you can say, on in the skin, around the muscles, and sometimes this wei chi gets blocked due to some reasons, and that is why your immunity suffers. So, since ancient times, all the healers they understood this concept that your immunity, energy, your wei chi, which is there in the skin, you need to activate it from time to time. And that is how the theory of massage and the science of massage came in. Of course, you have to know how to massage. All right. It is just not doing this or this. Okay. That is done in the park and not in the clinic. But Wei Chi is something which is activated by a scientific massage technique. So let us hear our guest speaker for today, and he will explain whatever are his experiences. So I'm making you the host, Shripaji. You can then share your presentation. Yes, please. You can unmute yourself and share your presentation. Please unmute yourself first. You will have to, yeah, you have unmuted yourself. Please go on.
Today we are going to discuss about the importance of TUINA in clinic, acupuncture clinic. See, basically, for many people, TUINA may be a new word. Basically, in China and in also in many of the Western countries, the TUINA is used along with acupuncture, moxibuction, and cupping. So these are main four modalities. Acupuncture, moxibuction, cupping, and tuina are commonly used in the clinic. In here in India, we see mainly cupping, moxibuction, and acupuncture is commonly used, but tuina is not so much popular over here. So that is why I chose this subject to introduce, and people should be aware the benefits of tuina in the clinical use in acupuncture clinic. So basically, what is tuina? Tuina has a two words, tui and na. Tui means to push, and na is to lift and squeeze. So basically, there are two methods are used in tuina. Also, there are some more strokes are there that we can see. But before going into the detail, we'll understand what is tuina. Basically, tuina is a combination of acupressure, massage, and manipulation. So there are three different techniques are combined in this tuina therapy, but it is somewhat different from our conventional massage. We'll also understand the difference between conventional massage and tuina. What are the pros and cons of it? So first, we'll understand the various benefits of tuina. Basically, it can be used for pain relief. Also, it can be used to improve the circulation, to reduce the swelling, to clear the blockages, to remove the stagnation, reduce the stress, improve the sleep, improve the digestion, improve musculoskeletal health, improve lactation. See, these are basically clinical applications where it can be used. Now we'll see the key benefits of tuina and traditional massage. See, basically in tuina, the pressure required is a very less as compared to massage. Normally in massage, heavy pressure is applied. Okay, so this is a major difference. So as far as the therapist is concerned, the exertion while doing the tuina is very less as compared to massage. And in tuina, we can use a specific treatment for a specific purpose. So it is not like a you can use as a full treatment of half an hour or 45 minutes as a like massage. But in acupuncture clinic, if you are doing acupuncture or any other modality like cupping, moxibuction, then you might use only a specific technique which lasts for few seconds to few minutes. So where the exertion of the therapist is very less, he can conveniently use in his daily clinical practice. So this is one major difference. Another difference is Tuina focuses on the chi and blood circulation, whereas massage normally focuses on local application of muscles and soft tissues. Here, Tuina we can use for muscle spasm and removal of stagnation, Whereas with massage, removal of stagnation would be a difficult task. The massage is normally used on a specific local area, whereas in Tuina we can focus mainly on meridian and acupoints. So you get added benefits of uh, meridian massage or acupoint application therapy. Then another benefit is this is do not require any oil, whereas in massage normally oil is used. So this is performed directly on the body, wherein in between we use a uh, Turkish towel on the body, so to avoid the direct contact with the body, and it can be performed. So it is very easy application, and since the no oil is required, so it is very effectively managed in the acupuncture clinic, because if you use oil in a clinic for the massage, it becomes a messy process. Then as far as the exertion is concerned, since the pressure required is very less, so exertion is very less as compared to a regular massage. And this can be used, as I said, it can be used for a specific purpose for a very less period, whereas massage requires a session of 45 minutes or 30 minutes. However, you can use a dedicated massage, a tuina massage also in a clinic, but if it is required, then you can have a separate person appointed for that and you can get it done. But as far as we are referring to our subjects as a use of tuina in clinical practice of acupuncture, wherein you can have a small session of few seconds to few minutes and you can achieve the desired results. But what is the necessity of using TUINA in acupuncture clinic? See, there are certain cases where the local stagnation is there. So it is very difficult to get rid of the stagnation with acupuncture. It requires some more time. More sessions are required. But if you combine this with a TUINA, so you can achieve that result in a quicker time as compared to only acupuncture. And basically there are different applications wherein you can use is like neck pain, back pain, musculoskeletal disorders, premenstrual syndrome, fatigue, insomnia, headache, arthritis, osteoporosis, stress, digestive disorders, respiratory disorders. Also there is a separate branch of a tuina for pediatric purpose, wherein for small children's, right from few days to few months to certain age, where it is very difficult to use acupuncture, there you can perform uh, tuina to uh, relieve their symptoms. Also there is another branch is also known as cosmetic tuina, wherein you can use for cosmetic purpose, basically on the face. And since it is have very less pressure, it is very soothing experience for the patient as compared to massage. Now there are certain techniques are there in tuina. Basically these they have around 25 to 26 different techniques are there, wherein you can use this strokes. Basically these are done with finger, palm, hand, arm, can be used for this techniques. So certain techniques are rolling manipulation, kneading manipulation, circular rubbing manipulation, pushing manipulation, shaking manipulation, and so on. So this list is there. However, it is very simple to address. At the end, I'll also share some video wherein you can see how simple it is and it can be administered in the clinic. See, like giving a pressure with a finger, it is one of the technique. Giving the pressure with thumb, base of the palm, these are the techniques. So basically, this is used to improve the chi and blood flow, improve the circulation. At the beginning, Mayank sir have told about mentioned about Wei Chi. So basically, in the surface of the skin, the Wei Chi is moving and it protects us from the attack of the exterior pathogenic attacks. So when you activate this chi, it helps in improving our immunity and have the lesser attacks on our body. Also, in certain cases of the patients with arthritis or like that, when they have symptoms, their symptoms get aggravated when there is a change in the season. Like so, suppose summer to monsoon, when the season changes, their symptoms get aggravated because their body is not able to adjust with the humidity in the atmosphere. So it takes a longer time to get it adjusted with the change in the humidity. In such cases, Tuina helps them to uh, improve the circulation in the smaller joints, and which will improve their pain condition. So you can use this along with the acupuncture. Only hardly few seconds to few minutes are required to do perform this, and it can be done by the practitioner himself, because he doesn't require any separate person to do that, because it requires hardly few minutes. Now I'll share you one video where you can see how this is done. Now here you can see it is very gentle pressure is there, and it requires hardly few seconds or less than a minute, and there is a no exertion is there of the therapist, and the patient will get the benefit of the improvement of the chi and circulation in this case. So concluding this, I'll say uh, Tuina basically regulates the yin and yang. It strengthens the vital chi to eliminate the pathogenic factors. It can be used for the treatment of diseases accordance with the seasonal environment and environmental condition. So, like I said, when there is a change of season, the symptoms get aggravated in many patients. So, it is very useful in such cases where we can focus to their particular joints where they have the symptoms. And if you use this along with acupuncture, it will benefit them. So now I'd like to know that if anybody have some questions about this, that we can discuss it.
Okay, there is a question
Hmm.
uh, in the chat box. Does Tuina comes first or does acupuncture comes first?
Acupuncture comes first.
All right.
Yeah, after doing acupuncture session, we perform tuina to uh, enhance the effect of acupuncture.
Okay. And uh, in this video, we saw a towel which
Yes,
was placed, and then there was a kind of a rubbing action.
yes.
Does it follow a pattern? Does it follow a channel? Uh,
Yes, yes,
is the towel always mandatory?
yes. It is always advisable to use a towel so you avoid a direct contact with a person's body.
Okay,
That is why it is basically it is used when it is used on the limbs or on the back on the stomach. When you are doing on the small joints like fingers, there you don't require a towel. There you can have a direct contact with that area.
okay. I'm reading out the questions one by one. What does elimination of pathogenic factors relate to? Okay, Shripaji, if you have finished your slide sharing, maybe
Yes.
we can, you can stop your screen
Yes.
sharing. Yeah, yeah. So the next question is, what does elimination of pathogenic factor relate to?
Basically, it relate with our defensive chi. When your defensive chi is stronger, then that pathogen cannot enter into the body.
Okay. So I think for the benefit of the listeners,
Yes.
you had mentioned about the external pathogens, correct?
Yes. Yes.
Okay, so can you just briefly tell about which external pathogens are more, I would say, relevant here?
Basically, it depends on the season. All the factors are important: wind,
Okay,
heat, humidity, dryness, coldness. Because many a times wind bring more pathogen along with it.
okay,
Basically, wind is the carrier for other pathogens.
okay. So it depends upon the season. I think that's a very important point because if the season is autumn, it's windy, then
Yes.
we have to focus
Yes,
on
and you have to select a particular stroke in that way.
all right. So you
Yeah.
have different strokes for
Yeah.
different pathogens.
Yes, yes. Different pathogens means different modalities are there that there we can use that.
So can you give couple of examples of different strokes for different pathogens?
Basically, this lecture is meant for to introduce the importance of that because if we go into the
Just
depth of the strokes,
one example, one.
uh see, basically, if you are doing a finger uh, manipulation. So it can be used to remove the excess cuff from the local area. Suppose the sinusitis is there. So you
Okay.
can use your acupuncture acupoints and you can give this manipulation which will disperse the accumulated cuff from that area.
Okay.
So this is one example. Rolling can be used to relieve from the pathogen of dampness.
Okay. Okay. So here I would like to share something.
Mhm.
I have frequently observed that in many cases of pain,
Mhm.
when you feel the affected meridian, you will actually feel knots
Yeah.
along the meridian.
Yes.
And when you try to move it in a particular direction only, there are like crepitations there. Cut, 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 cut. A
Uh,
very fine sensation happens.
yeah.
And if all the practitioners, okay, we are having a lot of questions, but I think we should give you some take home value. So when you move your finger very lightly, if you move it hard, you will not feel it.
Yes.
So then it will be
So
a very, very difficult phenomena.
yeah, yeah,
So feel for the knots.
huh,
That is very important, and feel for the crepitations.
yeah.
These crepitations mainly I've seen around the neck and around the sciatic nerve. Okay, so these are the two areas which I always do a tuina on the neck and shoulder line. That is very
So
useful.
basically, this is the beauty of the tuina, where the pressure required is very less.
Correct.
So the sensation you can have the feel the sensation from that area, and you can perform it.
Okay, so approximately what is the time you think is required for a session of tuina?
Though if you are doing a particular session like full body massage. See, there are different sessions are there for tuina for shoulder, tuina for back, tuina for abdomen. So such session can last for 15, 20 minutes to 45 minutes.
Okay.
Independent session. But if you are using along with acupuncture, then few minutes is sufficient.
Is
Yeah.
enough. Okay. Now,
Basically, it requires around 2 to 5 minutes.
correct, correct. There is
So that
one,
is why it is very important that acupuncture should introduce in their clinic, so it can give a uh, better results to the patients. Because to strengthening the results obtained by acupuncture to last for a longer time, it helps a lot.
correct, correct,
And another thing is, we often see that the stiffness occurs recurrently. Because if we today we treat some patient, if you are treated for cervical and there is a, stiffness in their trapezius muscle, then the day after tomorrow, or next day or third day, you will find again there is a stiffness. In such cases also, this helps a lot because it removes the stagnation from that local area,
correct,
it
correct.
removes the pathogen from that area, and it strengthens the muscle. So the recurrence of the stiffness you can get rid of with this very easily.
Absolutely correct, because sometimes when we put in a needle, it may do part of the work, but that also tells us that we have to complement it with other systems.
Yes.
Now, there is a very important question. Tuina and gua sha,
Mm.
okay, are they separate, or you can use the gua sha even? Is that also part of tuina, or is
No,
it
no. Guasha is a separate technique.
okay?
Yeah.
It's a separate
Yeah,
technique,
it is
so
a separate technique.
not to mix the two
Because
phenomena.
the guasha, they have different tools they use, basically stone and horn. It basically depends on the which pathogen you want to remove. If the coldness you want to remove, or if you want to remove hotness, then accordingly you choose different guasha tools.
Correct,
But
correct,
here it is a purely combination of manipulation, acupressure and massage.
correct, correct. So, are the points also important here with this tuina, or is it just more general?
So that depends on the requirement. Suppose
Okay,
you require to uh, enhancement with the acupuncture acupoints, then you can use on acupoints. If you want to looking for a specific tissue or specific area, then you can perform on specific area. So it has got a wide application depending on the requirement.
all right. Now, there is one more question about the knots which we just mentioned.
Mm.
Friends, please understand that knots interpreted in two different ways. Firstly, there is a knot due to acute pathogen or some kind of stagnation or some kind of blockage. Okay. And secondly, you may feel knots which are lipomas and things like that. So don't confuse the two. Lipomas are independent things, they are separate, they are to be interpreted separately. Of course, here a massage technique does help in handling the lipomas also, along with moxa and other things. But in tuina, these knots they actually disperse. When you actually do the massage, you will see the knots dispersing and the flow gets released. All right?
No, basically, when there is a pain in the lumbar area, so there is always a cycle of pain and spasm, and because of this repetitive spasm, there you find some knots on the dimple area,
Correct.
for which this technique is very useful.
Very useful.
Because you have to break that cycle, then only that knot will go away, and they will have feel the improvements.
Correct. Correct.
And another most important part is, when we discuss about lumbar pain or cervical pain, in case of herniation of disc or nerve compression, when you do a massage, it is very dangerous. There are a lot of risk is involved. But however, you can use Tuina in such condition very safely because it gives very little pressure. You can target it to a specific area or specific acupoint and you can give a better results. So in such condition, it is very safe to use Tuina as compared to
Okay.
conventional massage.
Correct. Correct. Here I would like, yeah, you please complete, then I'll start.
Yeah, this is what I wanted to stress as far as the knots is concerned.
Okay. So, speaking about back pain, I have also, used these massage techniques in my practice. There are two very important things which I would like to share for all. So, one is the contra movements, okay, on the lumbar region. So, if you do, say, one side you go up, the other side you go down, and then when this side goes up, the other side you move your hand down. Okay, you use a warm towel, that really helps, and you do this opposite direction contra movements on the lumbar area. And then with your fingertips, as if from the spine, you are moving outwards about 4 to 5 inches away from the spine, as if you are opening up the channels that are, or the nerve pathways that are emanating from the spine, and you move it like this. And we have seen that instantly within 15 minutes the patient feels lot of relief. That is the beauty of tuina. Okay, so that is as far as
Just now, what
some.
you explained is a rolling finger technique. It is
Correct.
in Tuina, so it
Correct.
is very effective. See,
Yes.
basically, depending on the requirement, there are around 25 to 30 strokes are there. It can be mastered very easily, and it is very simple and safe to use.
Correct. So I'm just going through the questions. Difference between acupressure and tuina. Fundamentally, I think the
Acupressure can be a part of Tuina.
exactly. It can be part of Tuina, but Tuina has a added advantage of a, like you said, a acupressure, massage, and activating of the blood flow, chi flow, all combined is Tuina.
See, basically, when you are doing acupressure, it is normally finger pressure is given or pressure with some blunt surface like Jimmy or something like that. But in Tuina, you can have different fingers, different parts of the hand like knuckle, uh, base of this palm,
Yes,
then this elbow. It can be have variety of applications and it can have different values to it.
correct. Now, I think one question which is very important. When we look at the causative factors or the pathological factors, we usually talk about the external factors. But isn't it equally applicable for internal factors?
Yes, definitely. But basically here what we are targeting is in combination with a pathogenic chi, that is wei chi. And
Okay,
so
correct,
basically, it can be used for internal organ disorders as well, but these techniques are different. So
correct.
when we are combining with acupuncture, then you need not go for that. But if you are treating a, suppose some patient do not want acupuncture, he has a fear of needle, then you can have a complete session, a tuina session for him. Entire treatment can be worked out with the tuina.
Okay. So when we talk about internal factors, mainly we talk about toxic emotions and the effect of emotions on our health. And there are very special techniques. I think they are derivatives of Tuina, which you can look into. So there are some things like emotion freedom techniques, EFTs, where you do different
Tapping, tapping,
tappings,
tapping.
different points, and all that. So similarly, uh, what is the rolling massage? I would like to share one last tip, okay, for today's evening because there are hundreds of tips. There are specific tuina massages to drain the lymphatics. Okay, this is the combination of modern science along with the ancient technology. You have to learn the art of draining lymphatics with tuina, and that will give you fantastic results. And I'll share 3 points with you. One point on the stomach channel. Okay, so you with two fingers, one finger may injure that soft part. With two fingers, you massage this area. With two fingers you massage at the corner of the jaw here and at the temple. So if you do these 3 points, okay, the lymphatic drainage, even from the face and I would say, even from the neurological point of view, whatever happens in the head, it is facilitated by these 3 points, and you can see an improvement in your uh, facial symptoms, your radiance, and your health also. Okay. So now,
Even in this case of neck spasm, you can use these points along this sternocleidomastoid muscle to drain the lymphatic this thing from this area. This also relaxes the neck. Another for emotional disturbances, you can use this thumb on your yin thumb point and tai yang point, and you just give a gentle massage. This also relaxes the patients and reduces their stress level.
correct, correct. So feverish conditions can be treated. Where can we use in sciatic pain? These are some of the questions that are coming up in the chat box. So, do you think we should do tuina in fever? At least I don't think so.
They basically see, like we can also do acupuncture in case of fever. So as might well you can use tuina also in that certain cases. See, because there is a branch of pediatric tuina where all the uh, conditions of the children can be treated with the tuina. So it is a specific branch is developed for tuina where it can acupuncture cannot be performed on the children. So same is applicable for the elder.
Correct, correct. That's a very important point. So, for children, you must make use of tuina instead of acupuncture. I think that's a beautiful point. And even for elderly people, sometimes because they are fragile and there are a
No,
lot
and
of other.
another thing is the touch of body is very important as far as the children and elder are concerned.
Okay, okay.
Because nowadays all elderly persons are feel isolated because their children are not staying with them.
Exactly.
So when you have a touch their body with your hand, so they feel very much
Reassured.
yeah.
Correct, correct, correct. Now, of course, I think there are some people who are very curious to know about the use of tuina for weight loss or weight gain. What is your opinion on that?
It is very good to use tuina for both the conditions.
Okay, okay. So don't tell the
Actually, Tuina is very good for metabolic correction.
okay,
So
okay,
it is always help in such conditions,
okay.
and we normally use this regularly uh, when people come to us for metabolic corrections.
Correct. So, I would not like to share the points because that will be in a paid workshop where we will share the points for weight loss or weight gain. We don't want to give it today. Okay, that's our selfish reason. So please attend our workshops in the near future. You will learn a lot on this. We will take two, three more questions and then we can summarize on this topic. Can we do tuina for tinnitus and some guidance for colic pain in infants? These are the two questions.
See, basically, tinnitus, when we perform acupuncture, to strengthen the effect of acupuncture, we can always do tuina.
Okay. Okay. So, this point I would like to share for everyone, because I think after 35 or 40, the age criteria, many of us start developing some tinnitus or the other. Okay, it then builds up and it depends upon
Yeah,
person.
sometimes it is transient.
Yes, sometimes it is transient,
Transient.
sometimes it comes and goes, but then
Yeah.
35, 40, 50 onwards, it becomes more prevalent. But we have been, the scissor technique has been given, and I have suggested to elderly people, and they have found it very useful to do a scissor here like this. So rub this uh, front part of the ear, this whole line, okay, and the back part where the mastoid bone is there. So, but it's like this, the scissor technique. So if you do this, both sides for at least 3 minutes, and it is known to relieve tinnitus instantly. All right, so you
But
can try.
basically, it also depends on the
Yeah,
usage of
true.
your essence. People have must preserve their essence to avoid such diseases.
Correct, correct. So, like we all know, every symptom has many possibilities, okay, many causes. It is also about the essence, it is also about maybe the local pathologies, it may be side effect of some medication. Lot of possibilities are there. But yes, essence is very important for the special senses. That is sure. That is why in the ancient cultures, massage was done very regularly, tonics were taken very regularly, the seasonal challenges were met very specifically, all these things were happening. Okay, so any more questions? Colic pain for infants, any suggestions for that?
For colic pain, you can use a rolling massage.
Okay. On the abdomen itself?
Yeah, yeah.
Okay, so the rolling massage on the abdomen, maybe the circular movements. Uh, is that what you are referring to?
Yes, yes, yes,
Yeah,
yes.
all right. So, friends,
Basically, it disperses the
the
pain.
wind.
Yeah.
Yeah, all right. Friend, this is an introduction to the wonderful world of Tuina. We may not be able to give you full-fledged protocols or the therapeutic procedures, but we are giving you glimpses of what this particular therapy can help you. Uh, Patients love Tuina, and I personally have found out that in patients where we do Tuina, they keep on coming back for acupuncture just to feel good. In spite of not having too many symptoms, they keep on coming to you, and specifically for the neck problems, for the lower back problems, pain conditions, some gastric conditions. This is very, very useful. So, it is advisable that you must do Tuina in your protocol. Like if you are giving 10 sessions, then at least in 2, 3 sessions, you must do Tuina. So you explore the different movements that are involved, finger, base of the palm, the forearm, where you can do it with your maybe the elbow. There are many techniques that you can refer the books. You also have to find out the main points where the pathogens are trapped. Okay, there are very specific points where the pathogens can get trapped. And Tuina is also very useful for injuries, sports injuries, stagnations happen, the various knots develop. So you have lot of possibilities of using Tuina.
In my
Uh,
collection of books, I have written two books on Tuina. So
okay,
anybody can refer those books if they are
very good.
interested.
So you can definitely contact Shripad ji to get his books, and I think he'll be happy to provide them for you. So you all have his contact details. He is easily accessible. If not, you can post on our groups, and we will share his contact. Okay. So uh, now I think we'll take this as a last question. Can you do Tuina immediately after acupuncture, or are they separate
No,
sessions?
immediately it can be done.
You can do it
Yes,
immediately.
yes, yes.
Okay, so no problem. Where the
Yes.
needle was inserted,
No,
uh, you
you can do it immediately.
you can do it on that same area also. Correct. All right. So friends, that was a very, very informative session.
I
And
also thank you for inviting me for this AccuTalk session
yes.
as a opening batsman for this year.
Good. So you should send me this Tuina books as a complimentary gift. Okay. So for allowing you to be the opening batsman. Okay. I'll send
Yes,
you my address. You can
yes, yes,
courier it to me. All right. So with this, we are very happy to announce that we had a full house today. All 100 seat quota got filled today, and many more would be watching on our YouTube live also. Okay, so please join us every month, minimum once a month. We will be having our AccuTalk with many interesting topics. And please join on time if you want to be on this group and participate. Okay, so with this, thank you for being with us. You can see the recording on our Aspirations channel on YouTube. All right, you will find the recording there. With this, uh, I conclude this session. Thank you, Sripadji, for sharing your wonderful experiences. And I hope that you come up with new topics in the future also.
yes,
And
definitely.
share with everyone.
Yes.
Thank you. Good night. We'll see you next month. Thank you.